Hey everyone, this is Smriti Bhatia and today we will master the cubital anatomy all together. So, grab your notebooks and let's get started. So, what is cubital fossa? Cubital fossa is an inverted triangle that is seen or that can be observed at the proximal and anterior aspect of the forearm. So, if this is the forearm, here we can observe a triangle that is known as the cubital fossa. So, the cubital fossa has three borders, one apex, one base, or we can say it one floor and one roof. So, if we talk about the contents, not the contents, the basic structure of cubital fossa. So, we have 6 things to study. We have three borders. We have the roof, the floor, and the apex. Three types of border that we have are the superior border, lateral border, and the medial border. So the superior border is formed by the imaginary line that is drawn between the two epicondyles of the humerus. So between the medial epicondyle and between the lateral epicondyle, we have the imaginary line that forms the superior border of the cubital fossa. Okay, so here we have now next the lateral border. The lateral border is formed by the medial border of the brachioradialis. So here we can see like this. This is the lateral border, but this is the brachioradialis muscle and this side will be the medial side of the brachioradialis muscle. That's why I said that the lateral border is formed by the medial border of the brachioradialis muscle. The medial border, how is it formed? It is formed by the lateral aspect of the pronator teres muscle. Okay, so this side, this is the medial side, okay, and this is the lateral side. So this will be the medial border of the pronator teres and this will be the lateral border of the pronator teres. So the medial border is formed by the lateral border of the pronator teres muscle. Okay, so these are the three borders of the cubital fossa. Now let's get to the roof. The roof is this thing that covers the base or the floor, just like the roof of our home. So the roof is made up of the skin, the fascia, and the bicipital aponeurosis. Okay, these are all the contents that make the roof of the cubital fossa. Next we have the floor. The floor is this one. So the floor is made up of the brachialis muscle and the supinator muscle. Okay. Now next, speaking about the apex. This is the apex of the cubital fossa. Now how is this made? This is made by the joining portion or the intersecting parts of the brachioradialis and the pronator teres. This is the pronator teres. Okay, so it is formed by brachioradialis and pronator teres, the inserting portion. Sorry, not inserting, the intersecting part. Okay, so these are the all the features of the cubital fossa. Now next we go to the contents of the cubital fossa. So first of all, we should understand that this is the medial side. Okay, this is the lateral side, and we have to just remember one mnemonic, that is my blood turns red. So we have M B, T, R. M, we have to start the M with the medial side, and R goes towards the lateral side. So if we see M, B, T, R, so M is for the median nerve that is present over here. We can see this is the median nerve. B is for brachial artery. This is the brachial artery. Okay. T is for the tendon of the biceps brachii. This is the tendon of the biceps brachii. And R is for the radial nerve. We can see it over here. Okay, so this is MBTR, and these are the contents of cubital fossa. Okay, these are the contents of the cubital fossa. Now here, if we see, we create an imaginary line over here between the two epicondyles of the humerus, and we have the pronator teres over here, the brachioradialis over here. So over here it will form some apex. So this becomes the, just a second, this becomes the cubital fossa, the cubital angle. Sorry, cubital fossa. Cubital angle is a different thing. Okay, so next, these are the notes from which I used to study. So these are very simple notes, that's why I have pasted over here. So the cubital fossa is the triangular shaped area situated on the proximal part of the ventral surface of the forearm. Boundaries, there is superior boundary, medial boundary, lateral boundary, apex, roof and floor. We have studied all these things. And next we have the contents. We studied the mnemonic, my blood turns red, median nerve, brachial artery, tendon of biceps and radial nerve. Okay, the brachial artery divides into the ulnar artery and the radial artery when it goes distally. Then we have the clinical relevance, not the clinical anatomy, the clinical relevance. So what is the clinical relevance of this cubital fossa? First one is the blood pressure measurement. We use the brachial artery to measure the BP. Next is the venous puncture, and the third one is the intravenous injections. So these are the clinical relevance of the cubital fossa. So over here we have finished the theory of the cubital fossa. And if you like the video, then don't forget to hit the like button below. And before leaving, I have one question for you, and you have to comment it in the comment box. And the question for you is that which is the structure present most medially in the cubital fossa? So don't go before commenting the answer in the comment box. See you next time.